I think it is sensible to exhaust all of these options before you proceed with knee replacement surgery, especially if you are under the age of 65. This operation is a big operation, it's painful, recovery is prolonged. So in terms of proven non-operative treatment, that is, intervention that has a good scientific basis and has support in the literature, what I'd recommend is the following. Firstly, weight loss can make a huge difference to your symptoms and also to disease progression. If you're carrying extra weight, and especially if your BMI is approaching 40, then the knee is taking a huge amount of pressure. Weight loss can improve your symptoms and reduces the risk of complications significantly. Please see my little video on this. Second, non-steroidal anti-inflammatories. These are probably the most effective medication out there, and it's worth trying them if you have not before, especially if you have what we call generalized arthritis. That is, the condition affects more than just your knee. They do have side effects, especially tummy upset, but you can try them with medication which treats this at the same time. Please speak to your GP about this. Simple Panadol is also worth trying along with anti-inflammatories. Thirdly, activity modification. It sounds self-evident, but if something hurts, then it may be time to stop it. Especially if you're doing work which is heavy on the knees, then you may need to look at this as a change of direction. The fourth thing is a sensible exercise program. Often combined with weight loss, getting the knee into a groove, if you like, can be very effective. It will also help with your progress after surgery, if it comes to that, if you have good muscle tone around the knee. The fifth thing that I would suggest is an injection of local anesthetic and corticosteroids into the knee. I'm happy to do this for you, or your GP can arrange this easily. Well, that is all that I would recommend, which leaves a lot of stuff that I would not necessarily recommend. Everyone should be keen to avoid knee replacement surgery, which is sensible, but it also is not sensible to spend your money on stuff that doesn't work. So what would I not recommend? What does not have a lot of support in terms of proven clinical evidence in the literature? The first thing is nutritional supplements such as glucosamine or chondroitin sulfate, not a lot of evidence. Secondly, injections such as Synvisc or Durolane do not seem to be much more effective than simple local anesthetic and steroid, and you pay a lot more for them. Thirdly, rub-on anti-inflammatories generally I don't recommend. This brings us to other operations. Does arthroscopy have a part to play? Generally not. The evidence is that arthritic knees are generally not helped by arthroscopy unless there is a rapid deterioration because of a meniscal tear, or sometimes if there is a loose body causing symptoms such as clicking or locking. High tibial osteotomy are generally reserved for men in their 30s and 40s who are literally too young for replacement, especially if they have isolated wear on the medial or inside compartment of the knee and are doing physical work. Unicompartmental or partial replacements I'd also look at doing in younger patients and sometimes in very old patients as an alternative to a full knee replacement.